You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, a hot topic, a new laser treatment for people that are suffering with gum disease. With us, we have an expert on the topic, board-certified periodontist, Dr. Scharf. Dr. Scharf, welcome, I should say, back to the show. We've had you on before.
Thanks, Randy.
Now, before we get into the topic, this new laser that treats gum disease, tell me a little bit about your practice for people that don't know you. Well,
I'm a periodontist, board-certified periodontist, and I practice in beautiful Babylon Village, right on the south shore of Long Island.
Okay.
I've been in that location about 13, 14 years, and I was a couple miles west about 5 years before that. And the focus of my practice as a periodontist is really twofold. First, we help people regain their confidence, regain their smile by placing dental implants. That can be someone that's lost their teeth and has loose dentures, or someone that needs a whole new set of teeth. And another big part of my practice is treating periodontal disease. And you know, periodontal disease is really the #1 cause of tooth loss in adults. And we can do everything from cover recession when people have long-looking teeth, to treat gum disease, regrow bone around teeth.
A lot has changed, though, you say.
Oh, tremendous.
I mean, now it's a fun for you to take care of it. Whereas, expand on that. What do you mean by that?
You know, the treatment of periodontal disease has really changed dramatically in the 20 or so years that I've been a periodontist. When I finished my perio training, advanced periodontal disease was always treated with cut and stitch gum surgery. And people would do it because they wanted to keep their teeth, but nobody enjoyed doing it. No one thanked me for doing it when we were done.
Right.
And it was, although technically it was enjoyable to do, that's why a lot of people become periodontists, it's hard to enjoy doing it when you know that people weren't enjoying having it.
Okay, okay. So now this new laser has changed all that. I mean, is it really that different?
It's completely different
than the way it was before?
It's completely different. You know, before, when someone came in with advanced disease, they'd have a number of visits with a hygienist of scaling, 3 or 4 visits, and then they would have a number of visits of gum surgery, where we lift the gum up from around the teeth. I'll show you in a little bit. I brought some pictures to show you. And now with the laser, we can reverse 20 years of neglect sometimes, or 20 years of disease in a couple 2-hour sessions.
So things like no more bleeding gums, no more loose teeth, no more bad breath. These are, I mean, are these truths about what this laser can do?
Yeah,
I mean, not an exaggeration?
Not an exaggeration at all. This laser I found to be as effective or more effective at treating periodontal disease than was the old cut and stitch surgery.
Now, we should talk about your background in training. You're board certified periodontist. You're clinical professor, assistant clinical professor at New York University College of Dentistry?
Yes.
So who do you teach there? What's your topic?
Well, I teach treating periodontal disease and dental implants to people who are already dentists and are training to be specialists in those fields.
Okay, let's talk about, first of all, define periodontal disease. Is it gum disease, periodontal disease? Are they the same thing?
Well, they're 2 different words for the same thing. Dentists would call it periodontal disease, and most people call it gum disease or pyorrhea, and they're really 2 diseases that make up the family of gum diseases. The first one is gingivitis, which typically people would know as bleeding gums, and that's just limited to the gum tissue. And then if gingivitis is left untreated, many times it progresses deeper to the bone, and that disease is called periodontitis, or years ago it was called pyorrhea. And the end result of untreated periodontitis many times is tooth loss.
Okay, so gum, now when you're flossing and your gums bleed, that's gum disease?
Yeah, that's gingivitis. Your gum should never bleed. You know,
really?
If you brushed your hair and your scalp started to bleed, or you washed your hands and your fingers started to bleed.
Is that a fair comparison, though? Really? I mean, gums really aren't supposed to bleed at all.
Gums should never bleed. When people's gums are healthy,
right?
And what I always find interesting is many people, once we treat their gum disease, their gums don't bleed anymore, and they'll say, "My gums have been bleeding for 30 years. I can't believe. I just thought it was normal because they always bled, and now when they bleed, I know I have a problem. There's trouble." So healthy gums should never bleed, and it should never really be accepted as normal. It's not normal at all.
So if someone doesn't have bleeding gums, they're fine?
You know, not necessarily, for a couple of reasons. First, smokers almost never have bleeding gums, and smoking is one of the few things that greatly accelerates gum disease. In fact, it's very rare to have a smoker that doesn't have gum disease, and almost without exception, smokers don't have bleeding gums. The other thing is, once the gum disease has become very advanced, Randy, many times the gums stop bleeding because the problem is so deep into the gum, into the bone, that the gums aren't bleeding anymore. And I have a model really that'll show that to you.
Okay.
So when you look at this model from the outside, both sides look the same, and you wouldn't know that anything's wrong underneath. Let's look at this one side. When we lift up the gum, you can see the bone underneath, and this bone is normal. When you look at the other side, again, from the outside, you can't see the gum's like a curtain. It's like a stage. You can't see what's happening behind it. But when you lift up the gum, this side of the model shows bone loss. So
those roots are exposed. That's what I'm looking at.
Those roots are exposed. They're not in the bone as much. There's not as much bone around them. And as that happens more and more, eventually the teeth become loose and can fall out. And that's how somebody can have perfectly normal-looking gums that don't bleed, that don't hurt, that the teeth aren't shifting, and yet had very advanced disease.
So see your dentist and see if you have that going on.
When you go to the dentist,
because you may not have bleeding gums.
You may not have bleeding gums at all, but when you go to the dentist, they measure how deep those pockets are. 2 to 3 millimeters is normal. Deeper than that is where bone loss is starting.
Okay, so the laser takes care of that, wipes that out. And I have questions about the mechanism, how that works. But what are other symptoms?
Some of the symptoms of gum disease, again, are red, puffy, bleeding gums, tender gums. Bad breath is a common one when people have periodontal disease. As periodontal disease becomes more advanced, sometimes the teeth start to shift, so people get spaces between their teeth. The teeth start to flare out. If you ever see an adult who has sort of buck teeth or flared teeth,
interesting,
that didn't have that when they were younger, it's because the bone support on the teeth is being reduced, and now the teeth are starting to move.
So you see teeth that are kind of moving forward. I've seen that.
Yeah,
and that's really because they're losing bone?
The bone is what holds the teeth in, and then as the bone is lost, the teeth become weaker, and they start to shift, they start to move, they start to get loose. And I've had people who wake up with a tooth on their pillow, and that's the first time that they say, geez, I think I might have a problem with my gums.
Okay, so this laser, what, just goes in and just kills the bacteria?
That's one of the...
Is that what's happening?
That's how, part of how it gets rid of the gum disease. Yeah, what happens is the laser energy first goes into the pocket, and it removes diseased tissue but leaves healthy tissue untouched. If I were to take the laser and move it over a piece of newsprint, it doesn't affect the paper at all, but it will remove the ink from the newsprint leaving the paper undisturbed. So the bacteria of periodontal disease soak up light energy very well. So the laser goes in, it kills those bacteria, and it removes the diseased tissue very selectively and doesn't touch healthy tissue at all. It's more precise than any surgeon's scalpel could ever be.
Okay, so the way it's been done, or being done nationwide, okay, is you go in, you cut it out. I mean, is that right? Or scrape it out?
In effect, what we would do is we would make an incision and lift the gum up from around the teeth. Once the gum is reflected, we could see the root of the tooth, and we would scrape the tartar off the root in a hope to remove the tartar, to remove the bacteria. And then we would put the gum back. So it was sort of removing it mechanically. But in order to remove it mechanically, it was very invasive. We'd have to open the gum and ultimately close the gum. And the act of, cutting open the gum, reshaping the bone sometimes.
Very painful?
Well, not painful during the treatment.
But after the treatment, I mean, there's some downtime, eating?
It certainly can be.
And that's the old way. We're talking about the old way.
Right.
But the old way is being done every day.
Right.
And right? Is that right? Even in Long Island?
It's being done everywhere. And what's interesting is people always have a quandary. Nobody wants to lose their teeth. No one comes in and says, well, I'm okay losing my teeth. Who would want to go to work, see their spouse, meet their friends, and have half their teeth missing? Nobody.
Okay.
But people would be so hesitant to do periodontal surgery because they've heard horror stories from their friend or from their spouse that many people really make a conscious or unconscious decision to leave their gum disease untreated because they felt it would be, they'd rather lose their teeth than have that surgery done.
Okay, but that all has changed, I guess, because of this laser.
It's changed
Are
dramatically.
you the only person, I understand, in Long Island with this laser?
I'm the first periodontist on Long Island that has the laser, yeah.
And what's the downtime, by the way? Okay, so you have this laser treatment for the bleeding gums, bad breath, loose teeth, all those things. How soon can they be somewhat comfortable with their eating, chewing, things like that?
Well, they're comfortable right away. There's no, we met, 2 days ago I treated a gentleman in the morning and he went to work in the afternoon. So people take a Motrin or a Tylenol after treatment. They don't have the weeks and weeks of downtime or the longer downtime that cut and stitch surgery would have.
Are people traveling a long way to see you? Because you're the only guy that has the laser right now.
I'm amazed. People are coming from Montauk all the way on the East End, from New York City and everywhere in between, passing 30, 40 periodontists in between. And it sort of gets to my point that everybody wants to keep their teeth. Who in their right mind would make a conscious decision to lose their teeth? But if it means going through having periodontal surgery, a lot of people just don't want to do that. So it's sort of a way that you can have your cake and eat it too. You can treat your gum disease without having to have surgery.
Now, you say there's a lot of people that it affects their self-esteem, having this gum disease. Tell me more about that.
Well, when people have gum disease, a number of things happen. First, their breath isn't so fresh anymore. And it can be a subtle thing. Maybe their spouse tells them, go back in the bathroom, brush your teeth. But as we said, as much as you brush your teeth, you can't get rid of the bad breath many times. So what happens? You don't want to be in a social situation. You withdraw. Maybe you're on a job interview and you're sitting across the desk wondering if the person, can smell your breath.
Wow.
As the disease...
So they tell you this on consults?
Oh yeah. When I ask them, what can I do for you, or what are your problems? What can I do to help you? They'll say, oh, my breath is terrible. No matter what I do, I can't get my breath fresh.
I mean, is it that simple? Am I oversimplifying, I guess, the explanation? I mean, you're kind of zapping it out.
It's really very straightforward.
It's the bacteria. You're killing the bacteria.
The laser
so
does.
All tooth loss is basically from this bacteria that eats away at the...
All tooth loss from periodontal disease is from the bacteria getting under the gum, setting up this process in the bone whereby the bone is destroyed and eventually the teeth are lost.